Hello, I'm Dr. Shruti Kate. I'm a senior consultant medical oncologist practicing for the last 13 years. I'm currently practicing in Cancer Centers of America in Nashik. What is chemotherapy and how does it work? Chemotherapy is treating cancer with the help of certain medications which directly kill the cancer cells or induce self-death. We use chemotherapy in various scenarios. If the cancer has not spread, then we use chemotherapy medications to reduce the size of the tumor, sometimes to make it resectable, and also to prevent its spread in the other parts of the body. After surgery, we use chemotherapy to reduce the chances of spread of cancer and to increase the life of the patient. If the cancer has spread to various parts of the body and cannot be treated with surgery, still we can increase the life of the patient by using chemotherapy to reduce the cancer burden. Chemotherapy in this situation can also reduce the symptoms due to cancer like pain. Chemotherapy can be oral or it can be intravenous. At the same time, we use certain other medications depending on the type of the patient's cancer, which are targeted therapies, which can again be oral or intravenous. What are the common side effects of cancer treatment? Cancer treatment is evolving every day. The systemic treatment for cancer includes chemotherapy, targeted therapy, and immunotherapy, which can be in the form of oral treatment or intravenous treatment. Chemotherapy can have some obvious side effects like hair fall. Other side effects are decreased in appetite, feeling of weakness or fatigue, mild nausea or vomiting, and some skin and nail changes. You or your near and dear ones could be experiencing one or more side effects or actually not be experiencing side effects because as and how the systemic treatment for cancer is evolving, at the same time supportive care for cancer therapy is also evolving. Now we have medications which can be given prior to chemotherapy and also following chemotherapy, wherein the chances of nausea and vomiting are very minimal. Some chemotherapy regimes are very intense and can suppress your immunity. You may require to take certain injections which will increase your WBC counts, which are expected to go down due to these drugs.